So good morning, everyone. First, a big thank you to the SPM Homecoming organizers for inviting me today. I'm delighted to share our work with you, which is entitled Optimizing Stimulus Timing in fMRI to Enhance Both Non-Linearity Estimation. I hope the slides go well. So many of us are using fMRI to study brain activity through measuring the BOLD signal, but BOLD is only an indirect measure of neural activity. And here's what happens when a stimulus is presented: neurons fire, and this triggers the neurovascular unit, and a cascade of changes in the oxygen level, cerebral blood flow, and blood volume then follows. And together, all these shape the BOLD signal that we detect. So the shape of the BOLD signal is not fixed, but rather it varies depending on the brain condition and the pathology. And the way we design our stimuli would affect how sensitive we are to the shape of the BOLD signal. So this means that stimulus timing matters a great deal. And however, in clinical practice, the current approach is to use block designs. For example, in most studies involving a condition called CAA, which I'll explain in a moment, have used long blocks of visual stimulation of 20 seconds on and 28 seconds off, which sounds to be their gold standard. So these designs are excellent for detecting both amplitude differences, and they sit comfortably within the linear time invariant framework, which makes the analysis neat and simple using the GLM. But there is a catch here. We are potentially missing subtle features in the BOLD shape that could be clinically and cognitively critical, such as the ones used in repetition suppression experiments or in studying dynamics of the vascular blood vessels. So why should clinical practice care about going beyond the linear BOLD effects? Well, because many neurological and neuropsychiatric disorders stem not only from neuronal decline, but also from vascular dysfunction. Take this cerebral amyloid angiopathy, or CAA, as an example. So this condition occurs when amyloid beta builds up in the blood vessel walls. And so it reduces their ability to adapt to the blood flow demand. And this condition is closely linked to the cognitive decline and often co-occurs with alongside the Alzheimer's disease. And the problem is that it is detected too late. Either we are counting the number of microstructural bleeds in a structural scan, which is not a reliable method, or only post-mortem. So here you're asking an important question: can optimized fMRI timing help detect subtle features in the BOLD that can hint at vascular problems? So to address this, we proposed a model-based optimization framework where we simulated a virtual fMRI experiments based on event-related designs, because these designs allow for finer temporal resolution, and also they provide greater sensitivity to the subtle dynamics in the BOLD. And we consider 3 stimulation levels for within subject manipulation. In case of a visual stimuli, these could be variations in features like color, contrast, or flickering frequency. And so we tested for 3 different models, each with a bit of added complexity. And first, we tested for the classical GLM, which assumes a linear convolutional model using the canonical HRF. And then we used the Volterra model, which was introduced in the early days of SPM by Carl. And so this model embraces nonlinear temporal effects and can allow us to model interactions between closely spaced stimuli and also effects like adaptation. So it uses a first order kernel, which captures the HRF shape, and a second order kernel, which allows for modeling the changes in the neural response due to the stimulus history. And then third, we use a biophysical hemodynamic model. This model makes more physiologically informed assumptions, and it's based on Bayesian framework, so it provides a richer picture for us, and also it allows for, and it also accounts for the both neural and vascular contribution. Sorry, it's for example, it explicitly includes parameters like neural efficacy and vascular transit time. In terms of the optimization strategy, we first defined a random trial order, and then we systematically varied the three stimulus timing parameters. The stimulus duration, which was varied from as short as 1 second to as long as 24 seconds, and then minimum jitter and maximum jitter, or gaps between trials. And these were varied from 0 to 20 to 32 seconds. And so for each combination of stimulus timing that we had, we generated 40 randomized experimental designs. We then defined the contrast and model of our interest, and then we computed the evaluation metrics, and then we selected the best performing design. So for the evaluation metrics, we use two metrics. The first is called efficiency, which is related to the T statistics. And it was originally introduced by Rick Hanson and colleagues for the GLM. And here in this work, we revisited and extended this concept to measure sensitivity to non-linearities and to make it suitable for Volterra model as well. And for the hemodynamic model, we use information gain, which quantifies how much new insight the model gains from the data. Let's look at the results, starting with the GLM. So here we are looking at the heat maps of the efficiency at the optimal on duration for two contrast of interest, on stimuli versus rest, and comparing stimulus levels. And here are the optimal timing, stimulus timing. And so you can see if you are looking for detecting the bold amplitude, then block design still win. And then here, the heat maps of efficiency for both the Volterra model are shown at the optimal on duration, and for three contrasts of interest, all stimuli versus rest, first order effect, which capture the HRF shape, and second order effects, which capture the nonlinearities. And here are the optimized stimulus timing that we obtain. And as you can see, if you are looking for detecting the nonlinearities, then short jittered designs would win. And here we are looking at the results obtained from the hemodynamic model. And these are the heat maps of information gain for three effects of interest: all effects, neural effects, and hemodynamic vascular effects. And here are the optimal stimulus timing. So as you can see, if we are using a richer model and paired it with optimized stimulus timing, then we can tease apart the neural and vascular contributions in the both. So here we are comparing our optimized design with the gold standard block design that I mentioned, that is used in the CIA studies, that use 20 seconds on and 28 seconds off duration. And as you can see, the optimized design outperform when it comes to detecting the subtle features in the both signal, i.e. the nonlinearities and the vascular effects, and separating the vascular effects. So what is the big picture then? As you can see in this table, there is no single best design, but rather it depends on the analysis goal, on the model that you use, and on the effect of your interest. And so here in this work, we could perform optimization for the experimental design for detecting the nonlinearities in the volt signal, and we could also introduce a tool in SPM that people can use to optimize and evaluate their stimulation paradigms for any effect of interest. So we are now, in summary, we're now having a framework in SPM that allows the timing to be that allows the timing to be optimized, to be tailored to the specific research question, and also it helps balance between stimulus information and the temporal effects. And it highlights that different goals require different timing parameters, and also it enables us to use richer models for extracting greater insight. And the take-home message would be that stimulus timing is not just a fiddly technical detail, but it fundamentally shapes what we can detect and to which features of the board we are sensitive. And so the timing, tailoring the timing parameters should be matching to the research question. And last but not least, I would like to thank Peter and Martina for their incredible support and also for their trust in me to explore this previously unexplored field, very different from my background. And also thank you all for listening.